Do you ever just wish you had whiter teeth? Well, luckily we do have teeth whitening. Now, how effective really are these different teeth whitening products, and how safe are they? Well, in this video, I'm going to go over how teeth whitening works, and I'm also going to go over some situations where teeth whitening doesn't work so well. So make sure you stick around because I'm going to go over some other options as well at the end of the video. So let's start with the basics. So teeth whitening works by using some peroxide-based gels that penetrate your enamel and break down these stains that are in your teeth. There's only two ingredients that can help whiten teeth, either hydrogen peroxide or carbamide peroxide. Both of these will effectively do the same thing to your teeth. Now, you might have heard of different whitening options, like getting them done in a dental office and getting professional teeth whitening, or taking these whitening trays home and wearing these trays for certain periods of time. The main difference here is when you do it professionally in a dental office, they use a higher concentration. So they'll use a higher concentration of this hydrogen peroxide, and that means it doesn't have to sit on your teeth as long. And also you get results a lot quicker and they tend to be more effective. Whereas the ones that you take home, you tend to have to wear those trays for a longer period of time and have to wear them for multiple days to get effective results. Now, how safe are teeth whitening products? Well, they're actually really safe when done correctly. All they're really doing is getting inside of your teeth where those stains are and changing the molecular structure of the stained part to make your teeth appear more white. But they do have some drawbacks, and the main one is they tend to make your teeth sensitive. So if you're thinking about getting your teeth whitened and you know you already have sensitive teeth, then you might be a person that might not be a great candidate for getting your teeth whitened. And that's especially true if you do it in a professional setting because of the higher concentration that they use. So if you have really sensitive teeth, but you still really want to whiten them, one option is to take some at-home trays with a lower concentration and start wearing them and see how your teeth feel. Try wearing them for a shorter period of time first and try alternating days. Instead of wearing them one day after the other, try taking a day off in between. I'd also recommend using a sensitivity toothpaste, something like Sensodyne or anything that has some sort of sensitivity product in it so it can help make your teeth less sensitive. Now, the only other concern I have with teeth whitening products is they can damage your gums if done incorrectly. So hydrogen peroxide is actually really good for your gums because it's an antibacterial and it's also naturally produced in our body. But for it to be safe for our gums to use in like a mouthwash or something like that, you'd want to keep it in a lower concentration. But the concentrations of hydrogen peroxide or carbamide peroxide in these teeth whitening products are way too high to be safe to be put on your gums. Now, that being said, if you take one of these at-home whitening strips and some of it gets on some of your gums, is it a big deal? No, it's not really a big deal, and usually you can wash it away. At the very least, you might get like a sore spot or something like that that should heal on its own. And this is also why at those higher concentrations of these whitening agents, you have to have it done in a professional setting because of the risk of it touching your lips or your tongue or your gums or something like that and causing a lot of damage. That being said, still in a professional setting, if a little bit touches your lip or your gums or something like that, you'd probably be fine in a few days, but it can really be painful. It can cause this burning sensation and no one wants to have that. So if you're ever using a take-home whitening kit or something like that, make sure you follow the instructions and make sure that you're careful with not putting too much so that not a whole lot gets on your gums. Now, I want to talk about when teeth whitening works the best. Teeth whitening works really well in two situations. One, for surface stains, so things like coffee, tea, or soda, or things that you eat throughout the day that over time get on your teeth and cause some stains. And they also work for gradual yellowing of teeth over time. Your teeth aren't naturally super white, but they do work well in situations where there's no intrinsic stains or stains really deep inside your teeth. And I'm gonna get into that more in just a little bit. But if you have these extrinsic stains or stains that are on the outside of your teeth, these are stains again from like things that you drink or eat or even like smoking, then teeth whitening can work really well in these situations. These extrinsic stains tend to only be in the outer layer of your teeth, in your enamel. And teeth whitening works really well by penetrating into your enamel and breaking down these stains. Or even if you don't have any stains, if your teeth are just naturally getting a little bit yellower as you get older, teeth whitening still works well in these situations. But that being said, teeth whitening does work differently on everyone. There's really no guarantee that if you whiten your teeth, then you're gonna get amazing results. What I'd recommend is whether you do teeth whitening in a dental office or at home, to take pictures of your smile and your teeth before and after and make sure it's in similar lighting. Because a lot of people will not notice a small change in their teeth from teeth whitening. But then once you look at the picture, you look back and forth and you see, oh yeah, there actually is a difference in my teeth. And some people have to keep whitening their teeth regularly to get really white results. So I know some people, for example, that will whiten their teeth like every weekend, like every Friday or every Saturday. That's their whitening day. And then they do that week after week after week. And after like a year or two, then their teeth get really, really white. Now you might think like whitening your teeth that often has to be dangerous. Well, a lot of times when people do this like week after week, they're using lower concentrations. But again, they're doing it for a long period of time. So I think this is the most effective way to whiten your teeth. Now I want to talk about when teeth whitening does not work. Like I said before, teeth whitening does not work so well on intrinsic stains, or stains that go on the deeper layer of your teeth. Now these stains come from things like trauma to your teeth, or they're related to certain medications, like taking tetracycline when you're younger, or even having too much fluoride when you're younger, something called dental fluorosis. I'm gonna go over all three of those in a little bit more detail. So trauma to your teeth could be anything like grinding your teeth or clenching your teeth too much, leading to these cracks in your teeth, or wearing away the enamel of your teeth. Like if you're brushing too hard and you're over time wearing away the enamel and making your enamel thinner, because the dentin that's underneath is naturally yellow. So there's not much you can do if you don't have enough enamel that's covering your teeth. Now, medications can also cause intrinsic stains on your teeth. So something like tetracycline is an antibiotic, and it's actually not recommended when people are pregnant or in children anymore. But a lot of people, when they were younger, they were taking it, or when their mothers were pregnant, their mothers were taking it. But unfortunately, these medications can cause these brown spots to form on your teeth as your teeth are developing. So if you were a kid or you weren't even born yet and your mom was taking tetracycline, or you were taking tetracycline at an early age for whatever reason, then unfortunately you might have these brown spots on your teeth that you're just stuck with. And this is really similar with having too much fluoride as your teeth are developing. So a lot of times when kids have too much fluoride, they can get something called dental fluorosis. And usually that'll present really mild as these white spots on your teeth. And sometimes it can be more severe and you'll get these brown spots on your teeth, and really rarely it can be super severe where it can make your teeth weaker. But again, fluorosis can only happen as your teeth are developing. So once you reach the age of like 8, then your teeth aren't really developing anymore and there's really no risk of getting dental fluorosis. And usually this happens when kids swallow too much toothpaste or something like that, and they just have too much fluoride as their teeth are growing. Unfortunately, teeth whitening doesn't work as well for these types of spots. It's more unpredictable. Like those white spots from fluorosis, sometimes they'll whiten more and make things worse, or sometimes they just won't really even out properly, or these whitening agents just don't reach deep enough inside the tooth to get rid of these stains. What I'd recommend is try something small first. Try like taking an at-home whitening product first and use it for a short amount of time. Again, take pictures before and after and see if you notice a difference. If you start to notice things are getting worse, then obviously don't do any more whitening. Or if you start to notice that things are getting better, then you can keep doing it and keep seeing if it keeps improving your teeth. Like I said, teeth whitening works differently for everybody. Now, some other cases where teeth whitening doesn't work so well is if you have like a grayish or a bluish discoloration with your teeth. If you have more grayish or bluish stains on your teeth, these stains are just harder to lift with teeth whitening, and it just doesn't work as well. Teeth whitening also doesn't work if you have dental restorations or fillings. So if you have veneers or crowns or any dental work like fillings, those will not get whiter with teeth whitening. So if you have a bunch of fillings on your front teeth and then you decide to get teeth whitening, your actual teeth will whiten, but the part of your teeth that are actually filling will not change. So this could lead to some uneven results, and you might have to get some new fillings to match the newer, whiter shade of your teeth. And also, sometimes people have silver fillings where part of the tooth structure around that silver filling will get discolored and more gray. And usually this happens because of some sort of micro leakage where some bacteria is getting underneath that old silver amalgam filling and causing the tooth to look more gray. Whitening really doesn't work well on these situations either. Also, rarely a tooth can change color because it is getting necrosed or the tooth is dying. So sometimes what happens is the nerve inside of your tooth literally dies. And this could happen for one reason or another, whether too much trauma to the tooth, or some cases where you're hitting, like we call it traumatic occlusion, where every time you bite, you're hitting harder on one tooth. It could just respond by just dying. There's a lot of reasons that could cause a tooth to die, but if that is happening, then that tooth can change color because the pulp inside of it is literally dying. In this situation, whitening your teeth with the normal product won't do anything because that tooth really needs a root canal. And then you might need some sort of restoration over that tooth. In a lot of situations, you might need a crown to cover that tooth. And if you do have a crown, luckily you can change the shade of the tooth by doing that. So in these situations, if you look like you have teeth that are just harder to get the stains out, I would talk to your dentist and see if they can at least get you a sample or something like that, or see what other recommendations they have. But that way you don't have to like spend a ton of money or go a route that most likely will be a waste of money. So what can you do to whiten your teeth if teeth whitening isn't an option for you? Well, first understand that teeth whitening is elective. So it's not something that you have to do unless you're in some Hollywood movie and they're demanding that you have whiter teeth. Even then, I feel like you can use some AI generated thing to whiten your teeth. But anyway, if you really want your teeth whitened, but teeth whitening is not an option for you, you could try getting some sort of bonding or veneers on your teeth. So these are both some cosmetic options. So one option is literally a bonding, or sometimes you can call it composite veneers, which is basically just some filling material that you put over your teeth, but in a more aesthetic way to help whiten them or change the shape of them a little bit to make them look better. And again, all these situations, I'm not talking about cases where if you have actual decay and need actual fillings to get rid of the cavities. I'm not talking about that. I'm talking more so on the elective side or the cosmetic side. Now, putting composite over the teeth generally is more conservative because you don't have to remove any tooth structure. Now, veneers, on the other hand, a lot of times you will have to remove some tooth structure. There are some ways where you don't have to remove any tooth structure and can still get veneers, but veneers are basically this thin piece of porcelain that you put on top of your teeth. But again, they can also help by changing the shape of your teeth to make them look better. But again, in these cases, a lot of times you'll have to remove a little bit of tooth structure from the top of your teeth. Now, I did want to give a quick honorable mention if you had a tooth that needs a root canal or something like that and you're not going to get a crown to cover it. One option is internal bleaching. Now, internal bleaching, like the name sounds, is instead of whitening your teeth from the outside, you're whitening your tooth from the inside. So you'd only do this on a tooth that needs a root canal because you're already removing the nerve. But that whitening agent is placed in the inside of that tooth to fight those inside stains that are in the tooth. This is a really rare option, and obviously if you don't need a root canal, don't get this option. So obviously you should talk to your dentist about all these options before you do any of them. Now, just like anything, you want to make sure you maintain the results to keep these results long-term. And one of the easy ways is to do that whitening like every single week. Like every Friday or every Saturday, do that teeth whitening day where you put a low concentration of the hydrogen or carbamide peroxide on your teeth, and then that's it. And then you do it again next week. Over the years, this will take a lot longer to whiten your teeth compared to doing something in a dental office and getting it all done in one day. But it is still really effective and will help maintain your results as the years go on. You also want to avoid any food or drinks that will stain your teeth. This is pretty much anything other than water. So cut back on the coffee, the soda, anything that has some color in it. Now, for most people, that is pretty much impossible. So at the very least, try to rinse your mouth with water after drinking one of these other drinks. And then just practice basic oral hygiene, like brushing twice a day, flossing once a day, going to the dentist every 6 months. You'd be surprised. A lot of stains that are on your teeth can be simply polished away at your dental cleaning, like smoking stains or coffee stains. A lot of times your hygienist can simply scrape those off or polish those off to make your teeth look whiter too. And the more often you go, like if you go every 6 months, the easier that is to maintain. So with all that being said, teeth whitening I think is a great option, but it's not a one-size-fits-all solution. It'll work really well for some people, and it won't work that well for other people. Luckily, if you are really concerned about the cosmetics of your teeth and teeth whitening doesn't work, there are some great options that your dentist and you can talk about. Now, before you go, make sure you like this video and hit that subscribe button down below, and I will see you guys in the next video. How big of a deal is it if you have a missing tooth? And what happens if you don't do anything to replace it? If you ever had a tooth extracted or you're scheduled to get a tooth extracted, you could have one of two emotions. You could be devastated. Oh no, my tooth is gonna be gone! Or you could just not care. Oh, you gotta take that tooth out? No big deal, I got like